It's seen as one of the foundations of modern British society. Established after the Second World War and based on the ideal that good healthcare should be available to all regardless of wealth. Britain's National Health Service is experiencing increased demand from a population that is both growing and ageing, and funding that's not increasing enough to cope. NHS services have been under intense pressure. Patients left in corridors, delayed operations, staff shortages, and in some cases, deaths that could have been avoided. There are many that feel that the system is at breaking point, and if a solution isn't found soon, it could have a direct impact on people's lives.
A patient of mine who was an elderly lady who had a fall and developed severe abdominal pain, and she went to our local A&E department and had some tests done but wasn't properly assessed for several hours, and it turned out she had perforated her abdomen, and in the end she died from peritonitis, which was completely avoidable.
There's a shortage of doctors and nurses, and at the end of last year, thousands of patients had their operations cancelled, forcing the Health Secretary to apologise to the British public.
I want to apologise for the fact that we have had, regrettably, to postpone a number of operations. We're trying to do it differently this year. Last year we cancelled a lot of operations at the very last minute, so people got a call the day before to say their operation wasn't going ahead. That is obviously very undesirable, so we want to do it in a much more planned way.
Up to 100,000 patients this winter have had to wait in an ambulance for at least 30 minutes because of overcrowding in accident and emergency departments. For 70 years, the NHS has received an average of 4% increase in its budget each year. But after government austerity policies, it's now 1.2%. And it's claimed that by 2022, the shortfall could be as much as $27 million.
My last trainee decided they don't want to practice medicine anymore. Morale is that low. We know that doctors within 2 years of qualifying in the NHS are leaving the NHS. Either they're going abroad or they're giving up medicine altogether.
A health model held in high esteem, it is free and open for all UK residents. But can the NHS survive through austerity and all the other pressures it faces, while remaining free, accessible and maintaining its global reputation?